like to call to order the Quincy City Council meeting Monday, February 14th, 2022. Madam Clerk, please close the roll.
Councilor Andronico.
Present.
Councilor Kane.
Present.
Councilor Harris.
Present.
Councilor Liang.
Present.
Councilor Mahoney.
Present.
Councilor McCarthy.
Present.
Councilor Palmucci.
Present.
Councilor Phelan.
Present.
President DeBona.
Present.
9 members.
Thank you. If we can get a moment of silence, please use it as you wish. Madam Clerk, please read the open meeting law.
Pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible.
Thank you, Madam Clerk. In accordance with Chapter 20 of the Acts of 2021, signed by Governor Charles D. Baker, June 16, 2021, extending certain provisions of the open meeting law, general laws, Chapter 30A, Section 20, the City Council will convene via remote conferencing services that will live stream and air on Quincy Access Television, QATV, channel QATV number 9, Government Access. Madam Clerk, before we get into the items, I'd like to let all the city councilors, my fellow councilors, know we will install Rule 10 as we have in the past. Madam Clerk, first item on the agenda.
Number 1 is COVID-19 update by Marley Castley, Commissioner of Public Health.
Commissioner, you have the floor.
Good evening, councilors. Thank you, Mr. President. 1 second as I just share this screen.
And if we could, Commissioner, what we'll do is we'll have 10, 15 minutes for the commissioner, and then councilors, we'll open the meeting up to each council to have an opportunity to speak. There you go, Commissioner.
Thank you. Thank you for having me here tonight. It's an honor to give you guys this update regarding COVID-19 and where we are today and how far we've come from the past. So on the agenda, we'll discuss about COVID-19, the public health response from our department, the methods used for this data collection, the highlights and the data visuals for 2020 and 2021, and then comparing both of the years, and then taking a look at the Omicron surge and the current trends and our future plans at the department. The COVID-19 basics, we've been dealing with this for 2 years. We know that it spreads very easily through the droplets, touching the eyes, the nose, the mouth, and breathing in the close air when in contact with someone that is nearby that's infected. The COVID-19 variants of concern, we first started off with Delta, which was identified in India. We knew that it spread very easily, and we've now had a new variant that we're aware of, known as Omicron, which was identified in South Africa, which spreads 4 times more than Delta. We have seen treatments for this, the COVID-19 vaccines through Pfizer, Moderna, J&J, which J&J at this time is not effective against Omicron, and they are developing their own Omicron-specific dose. And I just want the viewers to be aware, although we've been pushing for the last 2 years, the symptoms to watch out for. I want to remind the viewers that if you are experiencing any fever or chills, cough, shortness of breath, difficulty breathing, any loss of smell or taste, or any of the symptoms listed here, to contact your primary care and to get tested as soon as possible. The Quincy Health Department response, as you see here, We've held COVID-19 vaccine clinics. We've done contact tracing and community outreach for some of the things that we are doing here. Since September 2021, sorry, I have this. Since September 2021, COVID-19 vaccine clinic events have been held here at the Quincy Health Department, along with 180 Old Colony, with Manat, and at the Manat headquarters site as well. But our department specifically has partnered with Manat, Dana-Farber Cancer Institute, Brigham and Women's Hospital, Brewster Ambulance, and Mass General Hospital to provide clinics that are more accessible for the public here at no appointments and strictly walk-ins. So far, the health department has conducted 15 COVID-19 vaccines here at the Kennedy Center, and we have vaccinated almost 1,100 individuals that have walked into this building. The City of Quincy vaccination rates as of February 10th, 2022, we have seen a large increase in a significant increase in one-dose vaccines. It is now at 89%. Our fully vaccinated makes up 79%, and our booster rate is now 44%. We do expect that more people in the public will be available to get the booster shot. We have seen, we've had to cancel 2 of our personal clinics here due to weather. The snowstorm has prevented many people from going outdoors to get these vaccines. And we hope that will be over 50% in the coming weeks. Since December 2021, the state provided 18,900 rapid at-home test kits that we gave out to the public to the best of our ability. In January, just last month, we provided 75,000 KN95 masks to the public through emergency management through the FEMA mask supply. We are expecting to get more KN95 masks in the future, and our test kits that we ordered back in early January are arriving in the coming days. And so when we do get both shipments, we are going to provide the public with KN95 masks and test kits once they become available. And we hope to do this at the end of this month. So our methods for our data collection that was pulled here from our team, we used Maven, which is the state database, and we also used another system called EDSS, Electronic Disease Surveillance System. And our data that we'll show you tonight is strictly confirmed positive COVID-19 cases. And so in 2020, we found out the census on April 1st that the city is now population size of 101,636. We saw 4% of the city infected at this time, which made up 4,124 cases. We saw 194 deaths that year, and total confirmed hospitalizations is 224. I do want to point out that our COVID-19 dashboard on the website has not been updated yet and will be updated this Friday. The metrics for the death count was just released last week to our department, which shows that our deaths are slightly higher. This is a reporting error on the Mass Department of Public Health with the new data that they have received. And you can see here our monthly confirmed cases in 2020. We saw 691 cases that month in April when the virus was first identified in March. And we peaked at 1,777 cases later that year in December. And this is our case distribution by age in 2020. We can see that the age bracket 18 to 30 made up 937 cases, and coming in second are 50 to 65. Our case distribution by zip code, we could see that the 02169 Zip code was impacted the most, followed by, I believe it's the Wollaston area with the 02170, and then North Quincy making up 17% of the cases. The number of hospitalizations in 2020, we can see that when COVID was first identified in March of 2020, the cases were peaking at that time. And with the original strain, we saw 124 people at the hospital due to COVID. And we started to significantly decrease, and it started picking back up again towards the winter time of 2020, but not compared to what we saw in March, April, and May. And our monthly confirmed deaths in 2020, we can see that when it was first identified in March of 2020, we saw 11 deaths, followed by 117, followed by 28. And then we saw significantly lower deaths leading up until December, which resulted in 27 deaths that month alone in 2020. And so the outcomes of hospitalized cases in 2020, we had 224 total hospitalized here in the city of Quincy. 109 of those died, which makes up 49%. 55% did recover, and 60% we don't know. And it'll be difficult to get that data because it's not updated in both of those systems that we used. So we'll focus in on 2021. Again, our population size of it is 101,636 based on the April 1st, 2020 census. And in 2021, our cases pretty much doubled. We saw our percent of confirmed cases among the city population at 8.3%. So this made up 8,463 cases. We had 56 deaths in 2021 related to COVID-19, and 93 were hospitalized. Our monthly confirmed cases in 2021, we can see that we peaked in December of 2020. We started going down. We saw the decrease. We bottomed in June, and cases started rising slowly and significantly in the fall going into this winter, which you can see that in December alone was 3,000 cases for that month. Our case distribution by age group in 2021 compared to 2020, we can see that we've doubled across the board except for our seniors. And I'll show you that graphic in the next coming slides. So our confirmed cases by zip code in 2021, we can see that the 02169 general Quincy area made up 61% of the cases, and the Wollaston area and North Quincy area 18% each. Unidentified, those individuals might not have had the proper documentation, or it may have moved and are resulted in the database as unidentified. So our monthly confirmed deaths in 2021, we can see that they started to rise a little bit in January, and into March they decreased in April, May, June, July, and August, and we saw that big uptick in September, and going into December, consistent numbers there, which resulted in 56 confirmed deaths. Our monthly hospitalizations in 2021, we can see that January, again, following by what we saw in December of 2020, that trend continued to go downhill. We did see it pick up again in August and going into November and December as expected by the Omicron variant. This resulted in 93 confirmed hospitalizations for 2021. And so our hospitalized cases in 2021, we had 93 in total. 47 of them had died, 21 had recovered, and 25 are unknown. And again, we don't believe that we will know that outcome. And now we'll take a look at both 2020 and 2021 side by side. For January and February in 2021, it's a little bit different because in March of 2020 was when COVID-19 was first detected in Massachusetts. We can see that both the Delta, the original strain, and Omicron both all bottomed in June, and then they started picking back up in July, most likely due to the 4th of July celebrations and the gatherings. We can start to see that it started to rise significantly in August, September, until the end of this year in 2021, but pretty much modeling the 2020 chart. In our case distribution by age group in comparison between 2020 and 2021, we can see that some of the cases have doubled in some age brackets, especially in the minors, 18 to 30, and then 50 to 65. And again, as I highlighted in the past, our seniors, they relatively stayed the same, 759 in 2020 versus 843 in 2021. And so looking at the comparison of hospitalizations between 2020 and 2021, in 2020, we had 224. Half of that, almost half of that was in April of 2020, whereas in 2021, it was pretty steady across the board. And you can see the rise in November and December. And our vaccination rates, which started in March of 2021, we can see that it has been significantly higher each month, and we're continuing to make progress in all three categories. At least one dose vaccinated right now makes up 89%. Our fully vaccination rate makes up 79%, and our booster rate, which is now 44%. And again, I do anticipate that the booster rate will continue to increase as the weather, as we have better weather. And I do want to highlight that the value that's missing for May is because when dose record numbers are less than 30 for any age column, the state did not provide that for the city. And so where we are now, we can see that the Omicron surge has peaked, and we can look at the current trends from where we were and where we peaked and where we are now. We can see that the Omicron variant, which was first detected the week of November 4th, we started to see steady increase in the cases in the public in Quincy. We peaked at 2,000 cases on January 6th, which was after the Christmas celebrations and the New Year's celebration, and we have gone down sharply ever since. We are now at 138 cases for last week, and for today's update, we've had 8 total cases. So we've come a long way compared to where we were just a month ago and where we are now, and we're continuing to see decrease. Our plans in 2022 is continue to update the weekly graphic COVID-19. We would like to start tracking more communicable diseases that the state provides for us that track back to 2010 to 2019. And we would like to also conduct a Quincy employee health survey regarding vaccination status. This would be an anonymous status for each department, but we'd like to get the general census of how much of our employees are vaccinated by each department as well. And our future projects, we would like to do a community health needs assessment for the city of Quincy. And basically this will look at the current health statuses, the needs and issues. That way we can take this data and see where we need to put our resources to help the city. And that is all. I'm not sure if I stopped screen sharing. Did I stop it?
Thank you, Commissioner. I really appreciate you coming on here tonight, and you're great on time. So it gives everybody an opportunity to speak, and thank you for your graphs and your data. And I'll open it up to my fellow councilors. By a hand raise, Councilor Liang, please, you have the floor.
Thank you, Mr. President. Good evening, Marley. How are you?
Good evening.
I just wanted to, first of all, just thank you for putting together this really thorough presentation. I think that, with everything that has happened the last couple of years, right, at this point, it's really hard, I think, to, really predict anything now moving forward. And so, the information continues to fluctuate. I think we do everything that we can on our end, to respond. And of course, your office, I think, has done a phenomenal job at with you at the helm. And, we're at the mercy of the information that continues to come down and fluctuate from the federal government. So again, just, at this point, I think it's important to get a summary of what has happened to date and how we as a city have responded to it. I think, again, overall, the city has done a phenomenal job at doing so. I just think my only question for you that I'd love to get out there is communication and access at this point, I think, is the most important thing, right? Because things continue to change so much. I think that folks are getting vaccinated and still getting COVID, or they're not getting vaccinated and they are getting COVID. Symptoms change per person, even in, one household where folks are seeing each other all of the time. Symptoms are so different, right? So again, there's so much that changes and continues to change that communication and access to that information is the most important thing. So what do you recommend is the best course of action for those in Quincy who have questions or want access to any of the masks or the testing that the city is providing to folks?
Thank you for that question. We're doing our best to communicate with the public through either social media, such as a Facebook page that was recently created back in May of 2021. But we also provide our flyers for vaccinations to our local partners, either through the YMCA, our churches, senior buildings, to make sure that everybody is well aware of the clinics that we're holding here at the Kennedy Center. By providing updates regarding the changes in COVID-19, when the state told us to stop doing contact tracing in November of 2021, we did the best we could to send as many letters as possible to the addresses provided through Maven, so that they're aware of the updates and the changes and what they need to do when testing positive for COVID-19, or even when possibly having symptoms.
Okay, and then if folks do have questions, so I know if I have any questions on something, I can give you a call. I can give your office a call, right? But if somebody at home gets a notice that somebody in their household has COVID, and maybe they have kids in the school system and they have questions about that, if they have questions for the city, right, about that, like, is there someone that they should be calling, or anybody that they should be getting in contact with?
Yes, they can definitely call our department. We have 3 nurses that can guide anybody with the questions and concerns that they may have. So if they call our department, they'll be transferred to our nurses that can give them the best advice when dealing with COVID.
All right, thank you again. I appreciate all the information and the updates, Marley. Just so much changes, and there's so much information coming from so many different places. And I think for our purposes, right, in answering questions to constituents, obviously you were the best person to go to for that information. So I appreciate you coming here tonight and sharing that. And I will just leave it with, we as a body, right, are responsible for approving any funding and any requests that come in. And I just want to put it out there. Certainly, if there's anything we can do to support the work of you and your office, as you folks continue to be on the front lines of this work, please let us know, and we'll be here to support that. So thank you for your time tonight.
Thank you so much. I truly appreciate it. And thank you for having me here tonight.
Councilors, anyone else? Councilor Mahoney,
Hi, Marley.
and then Councilor
thanks.
Phelan, I'm sorry.
Thanks for joining. So I do have a couple of questions, and I think it got more challenging, obviously, with Omicron, because more people were vaccinated, but they were still getting it. Were we able to keep track? I know we were getting most of the information from the state. Were we able to keep track of, like, the people who had it here in Quincy? Do you know how many of them were vaccinated?
The data that we pulled from Maven and EDSS does not provide that data. Again, that might update in the future. What we did see an update from the Mass Department of Public Health is our death count, which is significantly higher than what our dashboard shows at this time, which we found out late last week, which will be updated this Friday.
Okay. So, and because we weren't contact tracing, I think it just became very challenging for anybody, people who were dealing with it, people who were vaccinated were getting it, people who were not vaccinated might have been getting it worse, but everybody, it just seemed to be everywhere. And that was a big concern. I know too that they changed the policy in the schools. Maybe you could just give us an update on that too. Is it that they're testing the kids when they go in, or they're kids? What's the rules for the schools? I mean, because there will be people that would be watching here as well in regards to that.
Yes, so there will be a school committee update, but the schools are looking to drop the mask mandate at the end of this month. We'll take a look at the data, and I'll speak to the superintendent Mulvey. But the schools are testing. They have been provided at-home test kits from the state at no cost to each student each week.
Okay. And then for people, if there's people who are looking for, I know they can get them from the federal government and it's covered in their insurance. Do you have information like that you share with people as well to be able to get the test kits and where they can get them? Because I know there was a run on the test kits, but then now you can find them everywhere again. So.
Yes, you can find them at the CVS's, the Walgreens, Stop and Shop, Walmart. We are receiving additional test kits. We purchased test kits back in early January 7th, I believe, and they're arriving now, unfortunately, after the wave has gone by. But they will be able to pick up test kits here at our department, along with KN95 masks once they become available, which we hope will be either sometime this week or next week once we're ready to provide those to the public.
Okay.
And they can call our sorry.
It's okay. No, that's good. So call your department. Yeah.
Yeah, they can call our department for any of the resources and any of the concerns and questions that they may have, and we'll make sure that we refer them to the best of our ability.
Okay. And then my last question, this is just a question, I think you were mentioning it, taking the learnings that you found from what we've gone through and actually applying it, overlaying and applying it potentially to other areas of the health concerns. But what are the other things that you're learning as far as like Omicron's past us? Are there any other variants? Are there any other things that you're in touch with that we have to keep abreast of as we move forward?
So at this time, there are really no other variants of concern other than the subvariant of Omicron. Mm-hmm. We aren't seeing any difference in cases right now. Again, we only had 8 cases today alone. Compared to the 2,000 cases that we had back in early January. So a lot has changed in such little time. There are no other variants of concern, but that may change in the future.
Yeah, and I think the thing that we want people at home to know is that if it does, as things do change, we have massive amounts of learning of what we've learned in the last 2 years. So we're staying on top of what's out there and how it's coming, so that we can make sure that we're notifying people if there is something to come. Like Omicron came really fast and rapidly, and everybody did what they were supposed to do. They were wearing masks, they were testing, they were getting together for the holidays. We all missed each other, and then still they were coming down with it. So it's just a matter of being able to communicate to the general population what's happening and how we can better serve our community as these things happen, and hopefully roll out those things as quickly as we possibly can.
Yes, we did learn a lot from Omicron, and we were able to partner with many of the organizations that were listed above, and Manit has been a huge resource for the city of Quincy. They provided over 50,000 shots since March 2021, which is amazing. We do have plans in the future that going forward, our 2 vaccine fridges have arrived back in December of 2021, and we are looking to get signed off by the state in order to provide vaccinations from our department alone to help with the demand, whether there is a 4th dose or not.
Yeah. So, and this will be my last thing. I just wanted to mention, I know that you partner with Manit, and my family got all of our vaccinations from Manit, and it's unbelievably well-oiled machine of how they were able to manage that. So I can't thank them enough and thank the city of Quincy enough for the way that was managed, because every time I went, it just got better and smoother, and it was, it was comfortable and pleasant, and I can't say enough about it, because if somebody's nervous about going, it makes it very, very simple for anybody to go in and get their vaccination. So if you haven't done so, please do so. So thank you very much. Thank you,
Councilor.
I recognize Councilor Phelan.
Thank you, Mr. President. Molly, just that I'm actually one of them who did get the booster shot and did get Omicron. So I was I'm one of your statistics on there. But thank God I didn't end up in the hospital or anything like that. But the vaccines, are they still doing them down at Old Colony? Is that still clinic, or is it just clinics coming through your office?
180 Old Colony through Manit is still open, and we are still having clinics here at the Kennedy Center. We actually have one this coming Saturday with the Kraft Foundation through the Mass General Brigham this Saturday from 10 a.m. to 2 p.m. And they provide back Pfizer only vaccinations and testing.
So will you be giving out test kits there, or will you also, or is it just vaccinations?
So our test kits right now are actually still on the way. They should be arriving sometime later on this week. They're currently in New Jersey due to the weather. They were delayed. They've been delayed since January 7th due to the demand from universities, states, and other organizations. So they will be coming, and once they become available, once they arrive at our location, we will provide them to the public, along with KN95 masks.
Okay, so when you make that announcement, the general public will be able to come down and get them at your place, or will be?
Yes, they'll be able to come to the Kennedy Center and pick them up.
Okay, because I remember one time when all this was hitting, it was quite a line going out of the Kennedy Center. There was one Friday where you had a line going up the street, and so to get those out to the public, and you've been doing a great job about letting people know in your whole department. It's a tough time for you to come in and be the health commissioner. You come right in when it's probably the hottest. So so kudos to your staff. I think they're doing a good job, and I look forward to when people can go out and get those test kits and let the public know so they can protect themselves, because it is actually a scary thing, and having had it myself. And not having it before then, it was pretty scary. So I think getting those test kits out there are one of the best defenses that we can do, along with getting vaccinated. So the more we do that, the better. All right. Thank you, Mr. President.
Thank you, Councilor. And just to follow up, it was a perfect storm. It was right before Christmas time when we were handing out those test kits, which was intended by the state. And it did cause that perfect storm at our location for our last pickup day. We hope to prevent that in the future. We're looking at other possible sites to hand out those test kits once they become available.
Thank you, Councilor Phelan. Commissioner, any other councilors? Seeing none. Commissioner, thank you for your presentation. Your statistics very well done on your PowerPoint presentation. I really appreciate you coming on here with your team. It's a good thing to have the Kennedy Center in the same building as the health department.
Hey, Noel.
Really good.
I'm
Yes,
sorry,
yeah.
Noel. I apologize, Noel.
No
my
problem.
camera's not working. Do you
That's
mind
okay.
if I?
Absolutely.
Do you mind if I make
Councilor Harris, you have the floor.
Thank you very much. I was just in a chat online on text with folks from Manit. They have tests, they have vaccines, they have everything available. I don't know if I heard it wrong, but they have that available. Manit does. So I encourage folks, as I know some of my colleagues have, to go and get tested, get tests. They go and get a booster, go and get their first vaccines if need be. So I just wanted to shout that out, because I'm very much close to Kim Kroger from Manit, who has done a fantastic job, and especially all of the volunteers that all throughout this whole time. You have nurses that have given their own time to go support Manit, volunteer. There's so many volunteers out there that we really owe a debt of gratitude to, especially Manat. Manat, this city is really very fortunate to have Manat in their corner. So with that, I just wanted to make sure I got that out. So thank you. And thank you for the presentation tonight. It was very enlightening. Thank you.
Thank you, Councilor Harris. Commissioner, on the statistics that you have, the 89% first dose, the both shots are 79% and the booster 44%. Are you going off the eligibility of people that can get the shot? Or are you going off the actual 101,636 people that we have in the city of Quincy? What is that statistic coming off of?
So the statistics are coming from the state based on the 100,636 population that is eligible for a vaccine.
Okay. As I know you went through the slides and you did 2020 as well as 2021, and I was trying to read the 2022 in January. Do you have a January 2022 statistic? I was trying to read it and it looked almost close to 4,000 or 5,000, if I'm in the right ballpark. I know you have December of 2020 and December of 2021. It seemed like it really spiked quite a bit, significantly, since obviously July is like the down point. Do you foresee this continuing, this trend, or does it look like it's declining in numbers right now and it looks like it may go away? Or is this something that may be around for a little while? And when I say a little while, years or months, or what do you think as you talk to specialists in your particular area?
That's a great question, Mr. President. And, we continue to look at the data, and I have the data pulled here in the weeks of October 29th to February 10th. It made up 8,846 cases. 6,000 cases came from Christmas to January 13th. So we did see a significant increase in those cases. We are monitoring the variants of concern, and at this time, nothing has changed. Omicron continues to be the dominant variant at this time, and that may change in the future. It's very difficult to say how long this virus will be with us. It could be months, could be years. It's very difficult to say. But as long as our vaccination rates continue to increase, and we start to see vaccination rates increase in other countries, not just the United States, that's when we'll see the real numbers and the real data for COVID-19 and where we go from there.
On the cases, when you were talking about folks that got COVID, are you able to collect data that folks that have gotten COVID twice? For instance, I know your data comes out per person. Do you have a data statistic that says this person's gotten it twice?
That's a great question. And at this time, the state does not provide that data. The state recently just updated the death counts for Quincy as of last Friday. And again, our dashboard will reflect that this coming Friday, but it does not show individuals who have caught this virus twice.
My last question is statistic-wise, is there any correlation with the blood type? Anybody that's blood type A, whatever blood type you are you more susceptible to getting COVID? Has any studies come out on that particular item?
That's an excellent question. There are studies that are being conducted as we speak regarding the blood type and being infected with COVID, but nothing has been published yet with findings that are significant.
And the reason why I ask is this: if you're a certain blood type and you can find out data that supports this, it'd be more option to go out and get the vaccinations and the boosters. Last question, as well as I think as here, I know the booster shot is coming unrolled here. Do you foresee a second booster coming? I know it happened in Europe. Is there a second booster that could be coming, that another vaccination status of, and maybe it's, let's say, 6 months from now, another rollout of a second booster? Do you foresee that?
At this time, it's very difficult to say, and that's an excellent question. It's very difficult to say where we could be 6 months from now. Just 30 days ago, we saw 2,000 cases in a week, and Now we're averaging 120 cases per week. So it's very difficult to foresee 6 months from now. I believe that there will probably be another booster coming in the fall or winter of 2022, and it might be age specific from what I've been told.
I really appreciate you answering these questions, because they're obviously, as we come along, we get more data and we get more studies, and we can collect this more as you go along. So I really do appreciate you coming on. I know this body and for the future, before you, our Commissioner Ruth Jones was on here quite a bit, and you came on right at the tail end of that, and I really appreciate it. We'll definitely, if we have to have an updated status, we'd love to have you on back again. Thank you.
Thank you, President, and thank you, councilors, for having me tonight. It's a pleasure.
Thank you, Commissioner. Next item on the agenda, Madam Clerk.
Number 2, cyber attack update, Christopher Walker, Chief of Staff.
Thank you, Madam Clerk. And Mr. Walker, you have the floor.
Thank you, Mr. President, through you. And thank you also to Councilor Andronico for reaching out last week and bringing this matter forward and providing the administration the opportunity to talk a little bit about what transpired relative to the ransomware attack that hit the city's network almost 2 weeks ago. With me to answer any questions you may have is Director of Information Technology, Brian Glavin, and Network Administrator, Dominic Venturelli, who I believe all of you know has been with the city for quite a long time and knows more about the city systems, has forgotten more about the city systems than most of us put together. I'm going to walk through what transpired and the city's response, but first I do want to take this opportunity on behalf of Mayor Koch to publicly thank Director Glavin and the entire team from IT for some really remarkable work over the course of the last 2 weeks in response to this ransomware attack. This was a serious incident. The damage could have been severe and the recovery could have been quite lengthy. It wasn't, at least to our knowledge at this point. And that's a credit, I believe, the mayor believes, to 2 things. One is the systems we have in place within our networks. And 2, and probably more importantly, is the effort that Brian and the team from IT really put in over the last 2 weeks to get us back up and running. It truly was pretty extraordinary. They went well above and beyond what would normally be expected, literally working around the clock to get our critical systems back up, in some cases within hours, and in most cases within, just a few days of what transpired. So I do, on behalf of the mayor, again, really want to thank Brian and the team from IT for their work. So back to the basics of essentially what had transpired. Obviously, if anybody has any questions, please stop me. Our IT department, through Brian and the team, discovered something a little funky early last Thursday, now 2 Thursdays ago, Thursday morning, within the Quincy Police Department server when some things weren't running right. At that point in time, the IT department, as would be normal protocol, they shut everything down and started restarting the system to see what bugs existed and to get the system back up and going again. When they went through that restart process, that's when they discovered that something was really amiss and a suspect entity was inside the city network, and they had discovered a couple text files that, when opened, demanded a sum of money in return for the safe return of the city's data. This attack was a little bit more sophisticated, a little bit tougher to deal with than the usual attacks we're accustomed to when we see email phishing scams, essentially those emails where it's coming from a corrupt address and someone has to open a link to get to it. In this case, the hackers got in through a back door directly into the system. There was no email phishing required here. They got in through, we believe, through the investigation, through an application used only by a single department, and it's a public-facing piece of software, meaning that the folks in that department used the software, they accessed it through the internet, they logged on through the internet, not through the city's network, and that is what opened the back door. Once Brian and the team figured out the severity of what was going on, they contacted our security contractor, Sophos, who've been with us for a couple of years now. And they then enabled an emergency or a rapid response team. Basically, I think it's probably more than a dozen from what I saw on the update calls, dozen engineers working around the clock, essentially tracking down the source of the attack, tracking down signs of the attack in our systems, tracking down to see if anyone is out there on the dark web trying to sell any data, trying to figure out if any data was actually extracted. And that process went on over the course of, a week or so. The city maintains a total of 60 servers. Almost all of those have been deemed safe through the work of Sophos and our IT team, essentially going computer by computer, network by network, server by server, going through, scouring, scanning, and cleaning any suspect material off of the network. That process is just about wrapped up. Of course, we prioritized critical elements, and these are the elements I mentioned earlier when I offered the thanks to the IT department. The networks that were really critical to the daily operation of the city, obviously anything related to Quincy Police, the Quincy Fire, anything first responder related, and obviously our financial capabilities, our financial systems were the first places where the IT team and the team from Sophos dug in to get us back up and running as quickly as possible. As I said, just about all of our servers are up and running. There are one or two minor issues that still are being cleaned and searched by the IT team and Sophos, but nothing that is implicating the day-to-day function of the city. We do believe at this point that some data was extracted by the suspect entity, but fortunately that data was not anything, at least that we've discovered to this point, that data was not anything that wouldn't already be a public record. There was no confidential or material information that was stolen by this entity. All of our backup systems have been maintained, repaired, and did not suffer much damage. So we did not lose any data in the process, which, speaking anecdotally, talking to some folks in other places and the experts, that was really probably the biggest threat of damage that we faced, was really the entire theft of data, the permits, licenses, financial records, those sorts of things that really could have made operating the city a little bit more difficult than it is. But thankfully, our backup systems, which were backed up every day, those were intact and protected. Specifically relates to Quincy Public Schools. The only issues that were affected on that end were the email server and the Aspen communication network between the administration and parents and students. And that system, I believe, was up and running within a couple of days as well. All other records within the school department are kept on a separate server, and the hacker had no potential ability to get into those. From the city side, the employee information is kept within a second software package that is encrypted, and there was, to our knowledge, no breach of that information at this point. So that was another benefit to this. As I think everyone in this body knows, we don't maintain personal information of the public. Anytime someone pays a bill online or provides any kind of banking information to the city of Quincy through our system, it's always through a third-party application and not through the city's network itself. So there would be no capability for any threat to any member of the public's identity being stolen, being part of this. The security team has not found any sign on the dark web that anything is being shopped around. They are professional in knowing how to look for this and where to look, and we have not to this point seen any evidence of that. As I said from the beginning, we have good reason to believe that while this was a serious incident, based upon the quick, immediate action of the IT department and the systems we have in place with Sophos, that this was, knock on wood, because we're still working through this, a inconvenience more than anything else. We suffered no material damage, no real issues relative to the operation of the city. And again, that's a credit to Brian and Dom and really the whole team at IT. That's pretty much the basics, Mr. President. Obviously, I'm happy to answer any questions and defer to Mr. Glavin for any technical questions.
Thank you, Mr. Walker. I'll start. I'm going to start off with recognizing Councilor Andronico and then Councilor Palmucci.
Thank you, President DeBona, and thank you to Mr. Walker and the other gentlemen for joining us tonight just to answer the questions and give us an overview of kind of what transpired. At the time when I had asked about providing an update, news had not yet broken about the $3.5 million theft from the city retirement fund at the time, and I understand that that's somewhat of a separate issue regarding who oversees those security protocols. So really, I guess my first question would have to deal more so with that and sort of what recourse or steps the city has at its disposal to potentially recover those funds, if any.
Sure. Through you, Mr. President. Councilor, as you know, I'm not authorized to speak on that issue in any great detail. The retirement board is an independently governed body, and those questions are best directed in any specific nature to the retirement board, other than what the mayor has said in a couple of the news reports that have come out recently, that there is no threat to any of our retirees not receiving a pension payment, and that an investigation is ongoing at this point. I will add that these are two separate and distinct issues. One is not at all related to the other. I know obviously the news on some of these things broke at roughly the same time, but I want to make that abundantly clear, and to the best of my ability, that's as far as I can go, that these are very much two separate and distinct issues with two very distinct issues that led to them. And other than that, I would defer to the retirement board, council.
Right, thank you. One other question I had was, I know the city somewhat recently updated its website, and I was curious if some of the changes to the website included security upgrades in addition to a cosmetic change.
Through you, Mr. President, I'll let Brian jump on that one. I will just say that Sophos, which is the private company we hired several years ago to protect our network, they've been on there for several years. So it wasn't necessarily anything related to the network upgrade or the website upgrade this year. It was a couple of years ago, I think it was probably 2018 or 2019, where we really upgraded our security systems with Sophos and some other things that the IT department has done. I don't know, Brian, if you're on, if you can add a little bit to that and correct me if I'm wrong.
Oh, you're correct. It was 2018. And as far as the website goes, it is more secure. Our older website was getting a lot of emails on it that go into department heads. And they were kind of like bots that were just sending them 1,000 emails each night. We were deleting those out. The new website, none of that happens. It protects us a lot more just from noise, more or less.
Thank you. And I guess my last question would also be for Brian. I was hoping you could just talk a little bit about sort of what the city does and your department does to be proactive about our security capabilities and sort of constantly being on the lookout for ways to upgrade and keep the very sensitive information that we have secure.
So we have a dashboard with our antivirus software that gives us a view of the whole city. It shows, the 60 plus servers. It shows all of our devices connected to the network at any time. It shows a health status of each device and server, whether it's a green status, yellow status, or red status that we need to do something to it. So it's a really good overview. With this, we added advanced threat protection, which is just another module within the antivirus software that looks at everything. So it's a pretty good tool, and we see everything that's going on.
All right. Thank you again, gentlemen, for the time. I really appreciate it, and I'll pass it back to President DeBona.
Thank you, Councilor. I had Councilor Palmucci. Are you still ready to go, Councilor?
Yeah, I just briefly wanted to take the opportunity to thank Brian and his team for all their hard work. It's the only thing I can think of that's worse than having to deal with that cyber attack struggle to get everything back online is then having to come to a city council meeting to explain it to us knuckleheads. So we appreciate you being here and appreciate your hard work. Thank you very much.
Thank you, Councilor.
Thank you, Councilor. I recognize Councilor Mahoney.
Hi, Brian. Just a
Council.
couple of quick questions. So I know in 2020, was it 2019 that we had
2018, right when I started.
the 20? So welcome aboard when 2018 when it started. And I know that in an audit of the 2018, it basically said that we should probably put some things into place. And I know you did do that time. Was it the ransomware? Was it the same type of break? And like that was a BitLock, wasn't it?
No, yeah, and it was more of a phishing attack. Someone clicked on it. That's how it started.
Okay. And then
this attack, they really found a hole in our network through that public-facing application, and that's how they got in.
Okay. And then it was through the police department, right? Is that what you're saying? Is that, just to be clear, so you have 60 different servers and you think it was through the police that it came through, or do
well,
we know?
No, it's one server that has both police and fire software on it.
So we potentially, the breach happened through the emergency department's servers.
Yeah, through first responders application. Yep.
Okay. And do we know what the third party vendor was that they were logging into, or do we keep track of those types of things so that we can?
We do have that. I could send you that offline.
Yep. And then so with Sophos, are they on retainer, or do we only have them come in?
We did a retainer for 45 days. They're going to be with us. Okay. So we meet with them twice a day. And then at the end, they develop this extensive report that's going to go through everything, their findings, and what we should do to mitigate it going forward as well, even though we're doing it as we go.
Okay. And then my other question in regards to that is, so you did a policy back in 2018. Do you renew the policy every year? And do we invite Sophos back to the table to actually help update those policies?
Yes.
Okay. That's great. That's all good news. And then one other question, when it came to, so all third party vendors that are coming through, like I know, in my day job, there's certain things I don't have access to. Like I only have access to the third parties that I would need to be able to do my day job. Do we do that in the different servers so you're protecting different servers from, or do we let everything?
No, correct. They only have access to the server they maintain. And we also turned on two-factor authentication as a result of all this as well. So through
And you update people have to update their authentications every 90 days, that type of stuff. And then when if somebody leaves the City of Quincy employment, their emails are shut off immediately, correct?
Correct now, yep.
Okay. And then just one other question, 60 servers. So is Quincy College part of one of the servers that we cover?
No.
Okay. Is Quincy Retirement Board one of the servers that we cover?
No, we just do their email and their internet.
Okay. And then just turning over, I know that we were just talking about that, and I really do appreciate the hard work that you put in. And I realized there were two different breaches, and I absolutely understand, Mr. Walker, where you're coming from, because it was not good news for the City of Quincy in either case, because it's just hard because you're having breaches that are happening. But, one of the things I do find disturbing about the $3.5 million Quincy Retirement Board breach is that we also had a pension obligation bond that we were out there circulating at the same time. So with that circulation, not talking about anything about that, it was amended to be included in the disclosure, the $3.5 million fraudulent transaction. When was that amended? What date was that amended?
Through you, that was within 24 hours of the submission.
For the date. Yeah, I'm looking for the date. Was that October, November, December?
It was probably in the November range, I would think.
So it was in the November range. And I guess the thing that bothers me the most about that is that I was asking on a regular basis, Mr. Mason, and in fact, on December 13th, I was talking to Mr. Mason about the pension obligation, and he was telling us that it was circulated. That seems to be a pretty big thing that was just not disclosed to the city council, wasn't shared to the city council, wasn't shared to anybody, that there was something that had happened. Not that that would make a difference, but it would definitely make it look more transparent if that was something that you brought forward to us. And that's one of the things that really didn't sit well with me when I was reading that in the paper, or anybody actually in the City of Quincy, I'm sure when I was reading that paper, was questioning, how is it possible that this has happened? And secondly, that we didn't know, and that we were circulating a pension obligation bond underneath the premise that none of this had happened. And it does matter because it is the Quincy Retirement Board that we're representing when we're going out for that pension obligation bond. So I guess that's where I'm finding that frustration there, that level. So that's all the questions that I have, but that is definitely something that I think we have to work a little bit better on, is sharing information with the city council so that we're not seeing it on the news. I think this administration doesn't like to see things on the news either, but we have to kind of share more information before it gets out there, because this is important stuff. I'm sure when the investigation's over, we'll be able to find out a lot more about that one. Thank you.
Thank you, Counselor. Any other counselors? Counselor Phelan, you have the floor.
Thank you, Mr. President. Through you to Mr. Walker. A question on this. I know we can't really. There's some things we can't talk about with the retirement board, and there's still investigations going on. But I'm assuming that it would be possible for us to get a report on what's going on in the action, so we see what actually happened. Would that be through you, or should that be sent to the retirement board?
Through you, Mr. President, I would send that to the retirement board directly, Council.
Because I think it would be important that we find out. I know some of this is still under investigation, and there's limited things that can be talked about at this point. But I think clearly we're doing the pension obligation bond, we're doing a lot of these things that we should get a report from the retirement board on what happened and laying it out so the city council can be made aware. And it is, I know no one wants to see it in the paper, but we should be hearing about it beforehand. So I think I would request that at some point we set up something where we have a report from the retirement board, not only what they're doing, who's responsible, and what steps are being taken to clear it up, because I think we're very tied in. Whether I know they're independent, but I also think that those are things that should be given to the city council. I would request that at the next time, if I can. I know you're currently going through. The state is investigating, not the retirement board, but they're investigating the practice. So I think it's important that we're shown, like we are with Mr. Glavin, where we've been shown what Sophos did and all that, and we know we also should have the same with the retirement board, and that should be something that we should be made aware of. So with that, Mr. President, I'll yield my time.
Thank you, Councilor Phelan. I recognize Councilor Liang.
Thank you, Mr. President. I want to start by echoing the sentiment of my colleagues and thank my colleague, Councilor Andronico, for bringing this forward to have the discussion, specifically around the $3.5 million that came in as being missing. And I feel like with this data breach, it's two things that are in front of us, right? It's a breach of the data and finding out what had gotten stolen. And then the other piece to it now, it seems, is completely separate, which is, the $3.5 million. And so again, I want to echo that sentiment that I was looking forward to coming here tonight to learning more about that. And, I'm a little disappointed that we aren't, but I do understand the reasoning why and hope that, we're able to have those answers and, fairly soon in the coming meetings. But specifically on the data side, so Commissioner Glavin, I just have three questions about that. The first is, Mr. Walker had mentioned that the breach had come by way of public-facing software that one department has access to. And so just I want to preface this by saying, when it comes to software and engineering and all of that, right, I'm such a noob when it comes to it. And so if I'm asking questions you already answered, I apologize. I think I'm just looking for sort of the Ask Jeeves version of it. So we go through, you said it was Sophos, that is the antivirus company that helps us to ensure that with that public-facing software, they're constantly monitoring it to make sure that none of the breaches or the hacks or anything come through, correct?
Yep.
Okay, and then
when the devices are connected to our network.
I'm sorry, say that one more time.
When the devices are connected to our network, we're doing all of that.
Okay, and so are they also the antivirus software company for internal applications as well?
Yep.
Okay, and do we check in with them periodically for updates that they have on their end? I mean, are they in this sort of industry, right? There's always updates that they need to stay on top of as well.
So it updates multiple times a day on every device.
Okay, and how long have we been with them now?
We got them right after I started in 2018.
Okay. Again, I don't know as far as this sort of industry in this world goes, how many other companies out there do the same work that they do, but I almost wonder if it's worth exploring what other options are out there. I'm not saying, one and done, kick them to the curb. It's just that, if something happens, we have to, take care of our own first and foremost, right? And if that means potentially exploring other options, other companies that do the same thing, I'd be interested to see, sort of how they respond to the situation and if it's something that we should consider moving forward.
Yeah, we can definitely do that. I've met with the FBI and Homeland Security in 2018 and now again through all of this, and they definitely think this product is good. It's doing its job. It's helping us, but we can definitely look into what else is out there.
Okay. Is it worth it to, and or safer to have any folks out there who are knowledgeable in the space to bring on to have like sort of an internal person, coding and creating this sort of anti-theft software for us? Is that something that's possible or no?
Well, I think it would be worth it to get like a cybersecurity person in there who just focuses on that,
Mm-hmm. Yeah, you have an entire department to run, so like this one thing I think
one of the other things we're doing is we're doing network scans of everything on our system outside of Sophos, just to double check everything.
Okay, I would love to see that again explored as an option as well, is to have somebody that is knowledgeable in the space, and obviously given the talent that's out there these days, I think that we can certainly try to find somebody to bring in internally, because again, if Sophos is an external organization that we're working with, right? I always feel like the investment's a little bit different if we have somebody internal who's focused on this work. The second question I have is, to the sort of public facing software and private facing software. And so I have a note here that says that, there was public information where, again, when it's connected to your network, it's public facing software, and then everything else is internal. What protections are in place to essentially create like a virtual sort of like barrier, right, between that information? And so if, this person were to come in through the public facing software, what are the protections that are in place for them to not be able to access the private information, like the internal information, I guess?
I think the server that had the problem is offline still. The Sophos is still investigating it. I think what we're going to do is we're going to have to meet with this vendor and say, we got to do it a different way just to protect ourselves. What safeguards can we put in place so this doesn't happen again? Because I know the software is used by other cities and towns as well. So we're not going to put it back online until we know we're in a better position.
Gotcha. Okay, that makes sense. And then the last question I had was just, when it comes to education and training, I feel like, once everything is, taken care of and buttoned up and we're able to move on from this, my gut instinct is to say, okay, is it worth having a sort of regular, education, training, updates for all city staff? There's always an influx of city staff and a sort of turnover, right? And even for us too, just to know, if there are any updates or things that we should be looking out for, I think that would be really helpful. So is that something that's in place now? And if not, is it something that is worth implementing moving forward?
We do, through the state, we got Proofpoint, training, and we do that like twice a year. I think we send out like, what to look for in a phishing scam, stuff like that. But there's a lot of different modules we can send out just to make people more alert and what to look for.
Okay. Thank you so much. I know that I get very stressed out when, I even get like random emails to my email account sometimes and I don't open it. And then I go through and I update all my passwords, and that's just for my own email account, right? So I cannot imagine the behemoth of this task that you have in front of you right now, Commissioner. And so for the last 2.5 weeks, I imagine you probably haven't slept much, but I do thank you for your commitment and for your work. And just, same thing as I invited to Commissioner, to Marley in the health department, and same thing to you. If there's anything that we can do on the city council to support your work, to beef up the systems, to bring in, staff that are dedicated specifically to this, whatever resource you may need, we're here to be helpful. So thank you, and keep us posted, please, on what we can do.
Thank you, Councilor.
Thank you, Mr. President.
Thank you. Any other councilors before we go over for the second round here for councilors to speak again? Seeing none, we're going to go with Councilor Palmucci and then Councilor Mahoney. Councilor Palmucci, you have the floor.
Thank you, Mr. President. I just wanted to follow up on something that came up when another councilor was asking questions. To you, Mr. Walker. you had indicated that you couldn't discuss what happened with the retirement system because they were an independent organization and we didn't really have any role or oversight over this incident. And then I believe Brian mentioned when he was answering questions to Councilor Mahoney that the city handles the retirement system's email system. In my understanding, only based on what I read in the paper, because that's the only information I've received, the retirement system lost $3.5 million due to an email scam. So my first question to you, Mr. Walker, is doesn't the city have a role as it relates to our email service provision to the our providing email services to the retirement board?
For you, Mr. President, yes. I mean, my comment is related directly to the information flow, Counselor. I'm trying to be respectful of a process that the retirement board has requested of this office based upon advice from their counsel as to not share and discuss this matter as it is under investigation, not only criminally, but civilly. There are some issues involved here that are being investigated right now. And the retirement board have discussed with a number of the members individually. I've discussed with the retirement board's lawyer directly, because quite frankly, and I will say this, it would have been our position that we do have the capability to have a thorough conversation about this, regardless of what is or is not in their investigation. But right now, I'm trying to be, this office wants to be as respectful as possible to the wishes of the retirement board based upon the fact that this is under investigation from many different sources. And that's really the primary reason why, first of all, the independent agency part of this also gets into the amount of information that I have. This is not anyone, those people conducting the investigation, those people involved in this, the outside of the folks in our IT department that had connection with the email system. I don't have all the facts of the investigation. I don't have all the facts of everything that went on here. But I would say that, again, I'm trying to be as respectful as possible of the wishes of the retirement board.
I appreciate that. Thank you. I appreciate that. I would disagree with whatever those wishes are, given that we just had a rather robust and informative discussion about another cyber attack without giving away any state secrets here or doing anything that would jeopardize any type of investigation. So we are a responsible enough body that we know there's certain information we should not be asking for in a public meeting, and we should not be given in a public meeting. However, as we just showed, we can have a discussion where information is shared with both the public and the city council as it relates to something that is under active investigation. Now, my follow-up question to you, Mr. Walker, would be, given that the city was issuing bonds at the same time, what criminal or civil exposure is there to the city relative to the failure to disclose the $3.5 million theft from the retirement system?
Three, Mr. President. None, Councilor. That's a good question. So let's back up a little bit, because this is a city issue relative to the disclosure, which I do have some knowledge about. Those folks who would have handled the disclosure call at that time, there were a series of 200 something questions. Those folks in the municipal finance department wouldn't necessarily have firsthand knowledge of anything that was this issue going on in the retirement board. Secondarily to that, there is a legitimate question as to whether or not it was material. I could make an argument that it wouldn't have been material because it had nothing to do with anything under the control of the retirement board at that time. This was an appropriation made by the city council, authorized by the city. The money was never going to touch any system of the retirement board. A vote at that point had already been secured that once the money was approved, it was going to be transferred directly to the PRIM as voted on by this authority. So there was a little bit of a discussion. Once PARAC is the state agency that oversees retirement funding, we sent out the initial point of sale offering after these disclosures. They flagged it, said, hey, look, we're aware of this issue with the retirement board and this hack. It probably behooves the city to make an amendment to the disclosure and include this. We got that message back within 12 hours. The issue was amended. The disclosure was amended. No problem. And quite frankly, it wasn't going to affect the sale anyways. But to the key element of your question, there was nothing. This money was never the pension obligation bond was never touching the retirement board. So there was never anything material to that end that was going to be implicated. This was money that was appropriated by the city council, and it was going to be one wire transfer from the city to the PRIM, and that was it. It was never going to touch any of the systems that may have been not been impacted by a hack or human error or whatever happened wrong from the retirement board's end.
Okay, and so when did PARAC review our bond offering? Is that when it first happened, or did they just see
The
it?
day, no, the day, it must have been the day we offered the sale publicly.
Okay.
And I don't know, and I can
And
get
so
Eric, the day that
they
it
flagged
was
it and
within
said, hey.
hours,
Right.
that the offering had hit the streets, and within hours, we got a call from the governor's office saying, hey, PARAC has flagged this. You guys might want to think about whoever knows about this may want to add a paragraph in there. And it was, sure, absolutely, we'll do that. And that was the end of it.
Okay. So it's fair to say that the bonds weren't sold yet at that point?
No, because it was amended, like I said, I think within 24 hours. The offering was amended, the notice was amended, and the sale doesn't come until sometime after the notice.
Okay. Well, that's good. I mean, I think it's great that they flagged it because listen, I don't do financial law, but I mean, you read enough in the newspapers that people get hemmed up for not answering truthfully on mortgage applications, and then they have, they're looking at criminal charges in a federal case. So I think it's good that PARAC flagged it and that the city took the necessary steps to disclose it. You can't get in trouble by disclosing too much, that's for sure. So, okay. Thank you very much, Mr. Walker.
Councilman Mahoney, I'm going to go with Councilor Kane because he hasn't spoke yet. Councilor Kane, you have the floor.
Thanks, President DeBona. Just a quick question. Coming from another angle, because what I've read from the news, it sounds like it was an investment manager's fault that this money transfer took place. So when are we going to come to a conclusion on the, legal investigation, and when are we going to find out who's at fault? And I think Councilor Andronico asked this, what's our recourse to get the money back?
Through you, Mr. President, I absolutely cannot answer that. That's strictly a retirement board question, Council.
Okay. So, all right. So maybe we'll try to get the retirement board in here, answer some questions. Thank you.
Thank you, Councilor. Councilor Mahoney, you have the floor.
Thank you very much. So just a couple of quick follow-ups. Mr. Walker, I think you said you got an email from PARAC. Is that something you can share with the council? In regards to disclosure?
I don't know if I said email. I think we were informed by PARAC. I think I got a phone call.
Okay. So we didn't have any, it wasn't, just a letter came out from PARAC to all the boards, to retirement boards, telling them to watch out for this type of activity, but you only got a phone call. That's why we updated it. There's no hard document.
What type of activity? Are you talking about the hack? Are you talking about the disclosure?
I'm talking about that there was a letter that came out from PARAC to retirement boards all over the state telling them to watch out for it. That was what was in the news. That gentleman in the news was talking about that. There's a letter, there's a memo that you can see that came out from them to the retirement boards, basically telling them to be aware of phishing scams of this nature. And then because we had a pension obligation bond that was being circulated, they came back and suggested, you're saying they only suggested via a phone call, not via email or memo or anything like that. I was just wondering if we could see the copy. Everything else is out is out there. I just wonder if we could see it. And then secondly, on January 12th, I had asked, after the December 13th council meeting, I had asked by email, I sent an email to Mr. Mason asking for him to share the information once it all became public, meaning for all the councilors to see. And in the prospectus, the 173-page document, I did not see that added disclosure anywhere. So I guess, could I see that added disclosure where it was added so we could see that?
Sure.
In the package that was sent to the city council.
Sure.
On January 12th. Thanks. And then one last question to Mr. Galvin. Do we do phishing tests? I'm sure you do within the city of Quincy. Is there any test emails that go out to see how many people know what they're looking at, if they're looking at it?
Yeah, as part of the proof point module, we do phishing exercises.
And then is there?
Then we get a report on.
Okay, sorry.
Okay, sorry.
No, I was just going to say, when you get a report from the employees that may not pass that, is there like a training that goes with that?
Yeah, it sends them additional questions.
Yep. And then is there any training this is just a question because, in the financial world, you have to do all sorts of training when it comes to this type of stuff. And on top of it, then after you do the training, you have to pass the training every single year to say that you understand the importance of cybersecurity. And then on top of it, they just test you all the time. And it can be 2 or 3 times a day that they send it to you. And they send it to you very often because they know you're getting multiple emails all day long, just to make sure that you're taking the moment to read, which is very difficult when you get a ton of them. But, I just was curious to know, is there any extra training that happens for employees? Because it's a lot. But
we send it out twice a year, but do we get a huge percentage? We probably get like 50%, as you can imagine,
So it's not mandatory. It's just something that you ask people to do.
Correct.
Okay.
Correct.
Okay. That might be something we might want to consider in union policy, is that it should be mandatory, because these are things that, we're living in the world of technology. Yeah. So yeah,
Makes sense.
I appreciate that. I just think this is a second breach in 5 years. It only gets more and more. It's getting more sophisticated. So thank you.
Agreed. Thank you, Councillor.
You're welcome.
Thank you, Councillor. I recognize Councillor Yang.
Thank you, Mr. President. I just, in listening to everyone, sort of circling back to this $3.5 million, I guess I just have one. Why weren't we told about this?
Through you.
It's going to be towards, Mr. Walker, go right ahead.
Sure.
I mean,
through you, Madam President, I would just reiterate to what I've said previously, that this, I'm not the authority on this. I'm not the governing body of this. The mayor's not the governing body on this. I think that this communication to the body probably has to come directly from the retirement board. But I think that they were playing a level of caution, and I'm not here to agree or disagree with it, that this issue is still quite fluid, with the potential to recoup this money, with the potential of litigation going forward, with the potential of multiple investigations, that the board felt through its lawyer that any communication would not be entirely appropriate. And again, I'm having trouble. I'm in a little bit of a weird position here. I can't speak for the board. What I can do is say that my knowledge of the discussions with me directly have been relative to this have been that, look, we have to not talk about this right now. We can certainly, if the body wishes or the council wishes, I'm sure that the retirement board would be happy to enter into an executive session. But there was a concern relative to disclosure of this while these investigations were ongoing. I know it's not the best answer, but it's the best answer I can give, council.
No, and I appreciate it. I mean, I think that I'm personally am a little bit hurt and insulted, that we had this very, very important big conversation that was in front of us. And whether it was, through your office, Mr. Walker, or through the retirement board, or whoever it was, right? I mean, there is a certain level of trust I certainly place in departments and process, right? And so I think that I am, in this whole conversation, right, I'm sort of thinking, as I've been sitting here listening, okay, how do we prevent this from happening in the future, right? Because there will continue to be very large and important decisions in front of this body. And, I want to make sure I'm doing my due diligence, but I don't know what I don't know, right? And so, again, I trust the process, right? I trust that information will be provided to us to ask questions and to make the best decision possible. And, I guess I was just curious as to why this piece of information was left out, and in the hopes of trying to understand maybe how our info facts, sort of searching journey when making decisions moving forward, maybe that process needs to be changed. I'm not sure. It just seems like this is something that was really important, that I trusted would be something that would be disclosed to us. But I am, all right, it's just something to think about as far as process goes with information sharing moving forward. But thank you. Thank you, Mr. President.
Thank you, councilors. Thank you, councilors, for all your questions and concerns to this matter. really this is about, I think, reading it in the newspaper in the Patriot Ledger that it happened about a year ago this time. Is that correct, Mr. Walker? About a year ago this time, 2021 February?
Again, to the specifics of it, Counselor, I'd point you to the retirement board on exactly how this transpired.
All right. Maybe how about this, Mr. Walker? When were you aware of this happening?
Fall?
The fall. So maybe September, October of 2021?
Range. Yeah.
Range. Okay. It's just to this body, I mean, we have an obligation to the constituents of the city as well. This body was not aware of this until February 9th when it hit the newspapers. And I think some of the folks, my colleagues, have had some real valid questions. And I fully understand, Mr. Walker, that you have to vet this kind of through the retirement board. And how could you answer if the retirement board had found out right away, or was it 3 months later as well? Or can you answer to that?
I can't.
Can't. Okay. These are questions and concerns of the body, as well as of the citizens of the city, as well as all the folks in the retirement. I think everybody that's on here right now is paying into that retirement fund, and some of the folks are actually on the retirement, getting monthly payments here. So I think based on this body and the future of this deliberation and more of an investigation, I think we might have to get some more information from the retirement board, if that's okay with yourself, moving forward.
Absolutely.
I think that's okay. Thank you, Mr. Walker. I really appreciate you coming on and saying what you could say legally, and I appreciate Mr. Glavin and Dominic Montarelli for coming on here tonight and answering some of the questions and concerns of the fellow councilors. I thank you.
Thanks, Mr. President.
Thank you. We're going to move on to the next item on the agenda. Next item on the agenda, Madam Clerk.
Number 3, 2022-028, an appropriation for $16,400,000 for Pine Hill Cemetery expansion and renovation.
Motion.
Yep, go ahead.
Mr. President, motion to move to finance.
I got a motion made by Councilor Phelan. Do I have a second?
Second.
Second by Councilor Liang. We're gonna move this into Finance Committee and as well as being advertised. Anything on the motion? Seeing none. Any discussion on the motion? Seeing none. All in a voice vote. All in favor?
Aye.
Aye.
Any opposed? The ayes have it. That is a vote. It goes into committee, finance and advertise. Next item on the agenda, Madam Clerk.
Number 4, 2022-029, a resolve American Rescue Plan spending transparency.
Do I have a motion? Motion made. Yep. Councilor Andronico, you have the floor.
Thank you. Just very briefly, this is an updated refile of a resolve that we had filed this past fall. In due diligence, I just wanted to file it again and make a motion to approve and place in both the finance and oversight committees as we had done in the past fall. I just think it's important that we add another layer of transparency when it comes to federal ARPA dollars and where those are going, just as many other communities have. With that, thank you, and I ask for my colleagues' support.
A motion made by Councilor Andronico to approve and move into finance and oversight committees. Do I have a second?
Second.
Second by Councilor Liang. Any discussion on the motion? Seeing none, we're going to do a roll call vote. Madam Clerk, please call the roll.
Councilor Andronico.
Yes.
Councilor Kane.
Yes.
Councilor Harris.
Yes.
Councilor Liang.
Yes.
Councilor Mahoney.
Yes.
Councilor McCarthy.
Yes.
Councilor Palmucci.
Sorry, Madam Clerk, point of order. What are we voting on? Whether or not to send something to committee or the actual thing?
Committee for Finance and Oversight.
I'm going to abstain.
Counselor Phelan,
Yes.
President DeBona,
Yes.
8 members.
That is a vote. Next item on the agenda, Madam Clerk.
Number 5, 2022-030, a gift for $1,250 from various donors to DARE.
You have a motion here from councilors.
Motion to approve.
Motion to approve made by Councilor Phelan. Do we have a second? Second by Councilor Andronico. Any discussion on the motion? Seeing none, please call the roll, Madam Clerk.
Counselor Andronico,
Yes.
Counselor Kane,
Yes.
Counselor Harris,
Yes.
Counselor Liang,
Yes.
Counselor Mahoney,
Yes.
Counselor McCarthy,
Yes.
Counselor Palmucci,
Abstain.
Counselor Phelan,
Yes.
President DeBona,
Yes.
8 members.
That concludes our items on the agenda for the agenda items. Going into approval of previous meeting minutes, February 7th of 2022.
Motion to approve.
Second.
Motion made by Councilor Yang, seconded by Councilor Phelan. All in favor?
Aye.
Aye.
Any opposed? Ayes have it. That is a vote. Next item, communication reports from the mayor, other city officers, and city boards. City Clerk, do you have any utilities?
I do. Thank you very much. These will be brought in this evening and referred to Public Works Committee for scheduling and advertising. Grant of location for National Grid Gas for Quincy Avenue, and a grant of location for Mass Electric on Quincy Street and 73 Liberty Street. Thank you.
Thank you, Madam Clerk. Anyone else? Councilors? City officers, boards? No? Okay, next item, unfinished business and preceding meeting. Seeing none. Reports of committees. Seeing none. Presentation of petitions, memorials, and remonstrance. I have Councilor Harris.
Thank you, President DeBona. Earlier tonight, I spoke briefly during the presentation that was provided by the city's health department director. I felt it was, for me, important as a non-medical personnel to even discuss medical studies or treatments that maybe be going around through the media and other social media venues. We should not cause any more confusion the public is already dealing with. On that note, I want to reiterate that Manet Health has rapid tests that they are giving out to the public. You can obtain these tests at Manet Health North Quincy. They have test kits at all of Manet's sites in Quincy. People can just walk in and ask for a rapid test kit. Manet has locations, as we know, at North Quincy, House Next, Snug, and Quincy Point. We also give them out at Old Connolly Ave, testing and vaccine clinics that take place. These clinics take place on Tuesdays from 1 to 4 for testing, and that's for testing. And vaccines on Thursdays are given out from 3 to 7 p.m. Just so folks can get that information. I think it's important. I want to encourage my fellow councilors to reach out to our constituents and please pass this information forward. Again, as I said earlier, I'd like to thank Man at Health and all the staff and volunteers who have served our city on the front lines during this very trying time. Thank you, Mr. President.
Thank you, Councilor Harris. Councilor Kane.
Thank you, Mr. President. I before you had concluded the discussion on the cyber matter with the pension fund or the retirement board, I wanted to see if you could potentially indulge Madam Auditor, who serves on the board of the retirement board, and just so she could sort of clarify here what can and can't be discussed, and maybe allude to when we could find out more information about this matter, if you'd be so kind to indulge me and Madam Auditor.
No problem, Madam Auditor. Feel free to. You're muted still, Council. Madam Auditor. So, yeah,
yep. Okay, here we go. Respectfully, under the advice of our legal counsel, the board has been asked not to discuss anything that has gone on regarding this matter, as it is an ongoing investigation. The board has all been in agreement that we are not commenting on the matter until the investigation has been complete. We are assuming that at the time the investigation is complete, there will be a full report that will become, we are able to share with the council and with other people that are interested in what happened. But I understand your frustration, as we are frustrated as well, but we are going on the advice of our legal counsel.
Thank you, Madam Auditor. Does that clarify it, Councilor Kane?
Yeah, I just wanted to, have a voice from, we heard that we couldn't hear from anyone except for people from the board. Madam Auditor serves on the board. She's a reliable resource to us generally, so I appreciate that comment. I look forward to more information, just like the rest of my colleagues.
Thank you, Councilor.
Thank you.
Thank you, Madam Auditor. Thank you, Councilor Kane. Councilor Palmucci, you have the floor.
Thank you. I just wanted to add to Councilor Kane's question. I was going to, or it's my intention, I'm going to schedule an oversight committee hearing, perhaps about a half an hour before the next city council meeting. And I'll send out a letter to the Quincy Retirement Board asking them to appear before us to answer a number of questions. One, discuss the situation, but also two, discuss the safety of the monies that are currently existing. And then perhaps the bond issuance as well. But so when we get to scheduling of committees, I'll set up a meeting and we'll see if we can get someone to discuss at least a little bit about what's going on.
Okay. Could I just mention something about the bond issuance? The disclosure, the amended disclosure is not something that the retirement board would have been responsible to do. That disclosure would have came from the finance office.
Right, Madam Auditor, but the point is, at what point did the Quincy Retirement Board notify the finance officer, so that the Quincy wasn't committing a fraud in the market, right?
I will say,
right.
Okay.
Those are the questions that I would have for the Retirement Board. Is
okay.
The city was put in a very legally precarious position, because if we had sold bonds without that disclosure, it would be very easy, and someone would have a very good legal action against the city for selling bonds under false pretenses. Obviously we'd have a defense that Mr. Walker raised, which is that the city believes it was immaterial. But if I'm an investor and I'm buying $400 million worth of bonds, I want to know what the obligations and financial situation of the Quincy Retirement Board is. But so, I think that's something that we can discuss as we move forward. So thank you, Madam Auditor.
Thank you.
Thank you, Councilor. Any other councilors? We're still on presentations of petitions, memorials, and remonstrance. Do I have a Councilor Mahoney? Is that you?
I just want to follow up one other question. I'm sorry. This is every time we talk about the pension obligation bond, it raises one more question. Is there any chance that we'll be investigated? This is to Mr. Walker. The city will be investigated by the SEC. These are real questions.
For what?
Because, I'm asking the question because we're talking about the bonds, and that you said you put the the disclosure on, but the package that was sent to me, I didn't have the disclosure. So I didn't see the disclosure. I'd like to see the disclosure.
Yeah, no. I think I was pretty clear that within 24 hours,
you were
within
clear.
20.
You're being clear, but we're not.
Are you asking a question, Counselor?
I am. I'm actually asking the question. You're telling me.
Counselor, you asked that question before, and Mr. Walker did appear to answer the question. So
okay, if I could
let Mr. Walker finish, and then you can go back. Hold on, Mr. Walker, go ahead.
To answer the question, the disclosure was amended within, I believe, to be within 24 hours, 48 hours of the initial offering. Under no circumstances was the bond sale impacted by the issue with the disclosure. And again, I would make an argument that the city could very well say, look, this was immaterial. The money's coming from the city to Prim. It's never touching the retirement board. The question that was asked in the disclosure relative to the city suffering any major cyber thefts or anything like that, you make a determination that no, we weren't. That this was coming from a different entity. Now, that being said, CAREAC saw it, they flagged it, they asked us to amend it, and it was amended. It wasn't that big of a deal at that time. It was pretty easy to amend it. It didn't implicate anything that happened as part of the sale. The sale was not affected. It fixed itself within a few hours.
So the city is not being investigated by the SEC?
Of course not.
Okay.
No.
Finally, I have the memo in front of me from Mr. Mason. Dear members of the city council, it's all listed here. Not one place does it actually mention to us, oh, and by the way, there was a $3.5 million fraud. That had to be amended in the package that you all voted yes for. Nowhere. Just making a note. Thank you. It's just something he wasn't really not very clear.
Mr. President, I think we're trying to connect.
We're gonna wrap this up.
Two different things here.
Yep.
That's okay.
That's okay. We've already answered these questions. We're gonna move on. Any other counselors? Okay, we're gonna go on to motions, orders, and resolutions. Any counselors? Okay, scheduling of committee meetings and public hearings. I know we have something for Monday, February 14th. Councilor Phelan, that coming out of finance beforehand at 6:30.
That's on March 7th.
Okay. All right, that's on March 7th. Okay. Monday, March 7th, we're going to go at 6:30 with the two appropriations from finance. Is that correct? Yes. Okay. Any other scheduling of committee meetings and public hearings? I got Councilor Palmucci.
When we're not meeting for the next 2 weeks, is that right? One's a holiday, then the following week.
I see. Yep. We're not meeting until the 7th. Yep.
All right. I try and get.
I'm sorry. And then we're meeting again on March 21st. So 2 weeks later after. So March 7th and the 21st.
And do we have anything before the meeting on the 21st?
No, we do not at this point.
All right. So what I'd like to do is, with your permission, Mr. President, schedule an oversight hearing for 6 p.m. or a meeting of the oversight committee for 6 p.m.
We can do 6:30, Councilor Palmucci, if we could. 6:30, and we'll roll it.
Okay. And that'll also give us some time to get a resolution together and introduced at the next meeting for follow-up. So.
Well, this will give us 5 weeks. So 5 weeks total from today, Monday the 14th to March 21st. It gives us a full 5 weeks.
Good. Okay. Thank you.
We have that. So we go Monday, March 21st, 6:30, oversight. Councilor Palmucci is the chair. Any other committee meetings and public hearings? Councilors? With that, before we close, we are not going to meet again until March 7th, and we're going to go finance and then into regular committee at 7:30. So with that, we can get entertaining a motion to adjourn.
Motion to adjourn.
Second.
This is adjourned. Take care, everyone. Have a good night.